It starts with a swim, a peaceful afternoon, a calm lake, and a child enjoying summer. It's the kind of day you never forget, for all the right reasons, until it becomes a nightmare. Just 4 days later, that same child is unconscious in a hospital bed. Doctors scramble. The brain is inflamed. The seizures won't stop, and within a week, he dies. No warning, no second chances. The cause? A brain-eating amoeba, invisible, unstoppable, and very, very real. It's not a plot from a horror movie. This happened in the United States in July 2025, and it could happen again, anywhere, anytime. Its name is Naegleria fowleri. It's a free-living amoeba, meaning it doesn't need a host to survive. But when it enters a human body, it becomes a killer. This organism lives naturally in warm freshwater, lakes, ponds, rivers, hot springs, and poorly treated swimming pools. It thrives when temperatures rise above 30 degrees, especially in late summer when shallow water heats up. Most people will never encounter it. But if contaminated water enters your nose, that's all it takes. Once inside, it travels along the olfactory nerve, the nerve responsible for smell, directly into the brain. It doesn't need your bloodstream. It doesn't need a bite or a wound. It just needs one moment of water forced up the nose during a dive, a flip, or even a hard splash. There, it triggers a devastating brain infection called primary amoebic meningoencephalitis, PAM. This condition destroys brain tissue with terrifying speed. The first symptoms look like a mild illness, headache, fever, nausea. But by day 3 or 4, things escalate fast. Patients experience confusion, seizures, hallucinations, neck stiffness, and then coma. Death follows within 5 to 7 days, almost always. What makes Naegleria fowleri so horrifying isn't just how it kills, but how quickly it does it. Once in the brain, the amoeba releases cytolytic enzymes, proteins that dissolve brain cells like acid, melting plastic. It secretes pore-forming proteins that punch holes in neurons and glial cells, then engulfs the debris for fuel. Think of it as a single-celled blowtorch and vacuum cleaner in one. Burn, then devour. It doesn't multiply passively like bacteria or viruses. It hunts and feeds, using chemical cues to locate living brain tissue. The immune system responds aggressively, but that leads to more inflammation and catastrophic brain swelling. Blood vessels leak. Pressure rises inside the skull. Pain explodes behind the eyes. The brainstem, the tiny control center for breathing and heartbeat, is squeezed. Most victims die from cerebral edema, the brain swelling so much that it compresses vital structures, causing respiratory failure. There's no natural immunity, no built-in defense. The human body is simply unprepared for this ancient threat. Antibodies don't arrive in time. Antibiotics do nothing. And the symptoms are easy to mistake for viral meningitis until it's too late. And the worst part? It doesn't always announce itself. This isn't a theoretical threat. It's happening right now. In July 2025, a 12-year-old boy swam in Lake Murray, South Carolina. 4 days later, he began showing signs of illness, headache, fever, nausea, light sensitivity. Doctors suspected bacterial meningitis. Standard treatment was given, but it didn't work. By the time Naegleria fowleri was identified, it was too late. The boy passed away, surrounded by family and confusion. The news shook the region. Parents pulled kids out of lakes. Local health officials posted warnings. Swim teams canceled practice. But it wasn't the only case. That same month, additional reports surfaced from Texas and Florida, all in young swimmers, all fatal. and all pointing to one chilling pattern. The brain-eating amoeba is becoming more active and more enevometty, widespread. Here's the uncomfortable truth. This isn't a random spike. It's part of a trend. Naegleria fowleri is thermophilic, meaning it loves heat. It thrives in water that's 30 degrees C and warmer. Thanks to climate change, more freshwater bodies are reaching those temperatures earlier in the fine year and for longer periods. The warm season has expanded, and so has the amoeba's habitat. Historically, cases were concentrated in the southern U.S., especially Florida, Texas, and Louisiana. But in the past decade, cases have appeared farther north in Indiana, Minnesota, and even New York, where warm summers used to be rare. They're now routine, and shallow lakes hit the danger zone for longer stretches. What was once considered a southern problem is now a national threat. And if the planet keeps warming, this invisible killer will keep moving north. Day 1, pounding headache, low-grade fever, nausea. Feels like a summer flu. Day 2, worsening headache, vomiting, neck stiffness, light sensitivity. Day 3-4, confusion, hallucinations, seizures, loss of balance, rapid decline into coma. The key red flag isn't just the symptoms, it's timing after swimming in warm, fresh water. If severe headache hits within 1 to 9 days of a lake day, you don't wait, you go. Here's the harsh reality. The survival rate is under 3%. There's no vaccine, no standard cure. Once symptoms appear, the clock is ticking fast. But there is one sliver of hope: early detection and experimental treatment. A drug called miltefosine, originally used to treat parasitic infections like leishmaniasis, has shown promise. It's been used in combination with induced hypothermia, cooling the body to slow the redox, amoeba's progression plus aggressive control of brain pressure, and a cocktail of antimicrobials. In 2013, a girl in Arkansas became one of the only documented survivors in U.S. history. She was placed into a medically induced coma. Her body temperature dropped and miltefosine administered intravenously. She lived after weeks in intensive care and months of rehabilitation, but even her doctors admit it was a miracle. The truth? Unless you catch the infection in the first 48 hours, and unless your doctor suspects Naegleria fowleri, immediately chances of survival are slim. PAM looks like meningitis, and the ER is trained to treat the most common thing first. That means antibiotics, fluids, pain control, while the right tests are ordered. But Naegleria doesn't wait. It outruns the playbook. That's why the single most powerful intervention is suspicion. Saying the words freshwater swim and Naegleria fowleri out loud to a clinician can change what they test for, how fast they act, and which specialists they call. So how do we fight something this deadly? With information and a few smart choices. The good news is Naegleria fowleri infection is entirely preventable. Here's how. Avoid getting fresh water up your nose. That's the only way the amoeba can enter your brain. Don't dive or dunk your head in warm lakes or rivers, especially in late summer and in shallow, stagnant areas. Use nose clips if you do enter. Keep your head above water when possible. Avoid stirring up sediment where the amoeba may hide. No cannonballs in murky shallows. Assume untreated hot springs and poorly chlorinated pools are risky. Well-maintained, properly chlorinated pools are generally safe. For at-home sinus rinses, Neti pots, never use tap water unless it's been boiled and cooled. Use sterile or distilled water only. Most importantly, if you or someone you know develops flu-like symptoms after swimming in warm, fresh water, mention Naegleria fowleri to the doctor. Share the timeline. Demand urgency. It could save a life. Can I get it from swallowing water? Swallowing isn't the route. It must go up the nose. Salt water is just as risky. Salt water and the ocean aren't typical habitats for Naegleria fowleri. The danger is warm freshwater. It lives in every lake. No, but you can't tell which ones carry it. Heat plus stagnant, shallow water raises risk. Chlorinated pools are dangerous. Properly chlorinated and filtered pools are generally safe. Poorly maintained pools and splash pads are not. We live in a world full of wonders, but some of nature's smallest creations are also the most terrifying. A brainless organism that targets the human brain? That's not just a horror story. That's biology. Invisible threats, sudden deaths, science stranger than fiction. If this video opened your eyes to something new or gave you chills, there's more coming. Subscribe to Vital Oddities. Hit the bell. We dive deep into the strangest corners of biology and the human body every single Thursday. Because the more you know, the better your chances of survival. Stay curious, stay safe, stay alive.